On top of creating 3D models or visualizing anatomy, you can also use mixed reality tools for generating designs of structures. So here's an example of designing a baffle or a patch to close a congenital heart defect. So technically, this is called a double outlet right ventricle, where there's a hole that's basically connecting the right ventricle and the left ventricle. And so we want to be able to close this so that you have the proper flow of the heart. And so you could basically use mixed reality tools to see if this is an appropriate plan that we want to do for a particular procedure for a patient. And so here they're actually inside the heart as they're generating the patch. And then you can see how they can quickly kind of take a more normal view of what it looks like, while also having tools to quickly peer inside the anatomy to see if this is an appropriate fit. So there was a paper that was published recently that looked into virtual reality and its impact on baffle planning, and they found that the VR space's collaborative and interactive planning enhanced the baffle planning process. Here's a showcase of different use cases for virtual surgical planning in cardiac, where many of our customers come from is cardiology, but we do have a platform that is agnostic to this specific medical specialty. So this is an example of valve-in-valve planning, where a patient already had a TAVR valve, but then you can simulate the placement of a new valve and then look at how it might obstruct the flow of the blood within the heart. This is combining 3D models of candidate stents or valves that you might place within a region of the patient's anatomy, visualizing a 4D echo. So the nice thing about this type of activity is that you can just place the items that you're interested in and visualize or measure the fit of them. So you don't have to rely on some of the abstractions that are typically done in these virtual surgical planning procedures, where you're measuring things or creating landmarks and then using that as an abstracted way to assess the quality of the plan. You can actually just do it yourself and then see how it looks. And then here's an example of assessing whether a particular Watchman valve will be appropriate for closing the left atrial appendage. So here's a piece of anatomy here, and then you import the 3D structure of the valve, and then you can place it within the heart to see if it will fit appropriately based on that patient's anatomy.